Hello, today we are welcoming 3 famous nursing theorists into our hospital. This video will demonstrate 3 nursing theories. For the purpose of this video, timeframes of which the theorists practice nursing has been omitted. Please welcome Hildegard Peplau, Florence Nightingale, and Katharine Kolcaba. Okay everyone, please welcome our guests. They will be floating around the unit today observing patient care.
Hi, I'm Florence. Do you mind if I join you while you care for your patient?
No, not at all. Please feel free. Hello, Mrs. McIntosh. Are you ready to get up?
Look at this mess. No wonder your patient isn't feeling well.
I've just been really busy.
That is no excuse. How do you expect Mrs. McIntosh to get well if her environment is not conducive to healing?
I understand that. I need to start showing accountability for the responsibility I have for my patients and their health.
Can I speak to you outside for a moment?
Yes, sorry Mrs. McIntosh. I will be back in a moment.
Your patient's room is atrocious. It is unacceptable that you've let it become so messy.
I didn't realize it was so bad. I know cleanliness is important, but I was busy giving out medications.
Your patient's environment must be a priority. If a patient is cold, if a patient is feverish, if a patient is faint, if he is sick after taking food, if he has a bed sore, it is generally the fault not of the disease, but of the nursing.
I apologize. I became a nurse to make people feel better, not worse. It is my job to make suitable patient environments that promote health.
Don't apologize to me. Mrs. McIntosh deserves better.
I am so sorry, Mrs. McIntosh. Let's get this room cleaned up and get you feeling better. There we are, Mrs. McIntosh. Now that we got everything cleaned up and changed your linens, how are you feeling?
Thank you, Nurse Michael. I am feeling a little bit better. I think I'm going to go back to sleep after my meal.
Glad to hear that. I will let you be then. I'll be back to check on you in a little bit. Ring your call bell if you need anything. I just wanted to say thank you. I realize now how important a patient's environment is to their overall health.
The greater part of nursing consists in preserving cleanliness. It is an important part of nursing that cannot be overlooked.
I understand that now. Nursing measures aimed at preserving health are nothing without a healthy environment to support good health.
Nursing is achieved through environmental alteration. If environmental conditions such as ventilation and warming, light, cleanliness, quietness, pure water and efficient drainage are sufficiently present, they will aid in healing.
Hello, my name is Kate. My manager has assigned for you to shadow me.
Yes. I would like to observe the interpersonal relationships you have with your patients.
Okay. Follow me. I have been assigned a new admission. A post-op knee arthroplasty. Hello, Mr. Stevens. I am your nurse Kate and this is Nurse Peplau. I will be taking care of you today. How are you feeling?
I am okay right now.
How is your pain?
Not too bad.
I just have a few questions to ask you.
Okay.
How are you doing?
I am a little worried about walking tomorrow, and when the pain starts to set in. This is my first surgery, so I don't know what to expect.
I understand that this is scary for you. I am here to help with anything you need. We will work together to manage your pain. How does that sound?
Thank you, Kate. I feel better knowing that.
No problem. Have you had any recent hospital admissions in the past year?
Yes, 8 months ago. I had an episode of high blood pressure and my medications were not working to bring it down.
And has your blood pressure been okay recently?
Yes, everything is okay now, thankfully.
Do you know what caused your high blood pressure?
Oh, I don't think it's my fault. I just thought you got high blood pressure when you age.
No, Mr. Stevens, it's not your fault. But there are some healthy habits that you can practice to make managing your blood pressure easier. I will get you a pamphlet for you to read.
Okay, I would like that. I feel so bad. I could have been doing more about my blood pressure if I knew there was things that could help.
I understand, but you didn't know. I will help you learn how to manage your blood pressure now. I'm glad we could speak about this.
Thank you. I would like to know everything I can about my blood pressure before I get discharged.
I will be right back.
You have moved from the orientation phase into the working phase of the interpersonal relationship with your patient.
Can you explain the working phase?
Certainly. The working phase is where most of the work is done. The nurse functions in many different roles focusing on patient care.
What are these roles?
Well, roles such as stranger, teacher, interviewer, counselor, observer and mediator, as well as a leader, surrogate and resource person.
I see. So at first I was a stranger to my patient. But as our relationship progressed, I became an observer, an interviewer, and counselor. And now by teaching him about managing high blood pressure, I am a resource person and teacher.
That's right. And as your relationship progresses, you will play many of the different roles until you terminate your relationship.
I get it. Thank you. Hi, Mr. Stevens. You are being discharged. Before you go, I just want to go over what you've learned.
All right. I have learned so much from you, Nurse Kate. Thank you. I now know that following the right diet and exercising safely in conjunction with my medication will allow me to have a healthy blood pressure.
And how is your knee? Are you confident that you'll be able to manage your pain?
Yes, I've been moving around great. I will take my medication as prescribed to make sure my pain continues to stay managed.
Okay, so you'll be back for your follow-up visit at the outpatient clinic downstairs in 2 weeks?
Yes. Hopefully I'll be walking perfectly by then. Thanks again for everything.
I really learned a lot from Mr. Stevens. The fact that he was here for a knee replacement but needed teaching about his blood pressure taught me how important it is to assess for knowledge deficits and provide appropriate teaching to all of my patients.
Thanks, great. The resolution phase is a time to reflect and understand how you will use the knowledge gained in future practice.
Thank you, Nurse Kolcaba, for explaining. I think I'll be able to make my patient more comfortable now.
I'm happy to help. Let me know if you have any questions.
Hi, Simon. My name is Jill. I am going to be your nurse today. You don't look very well.
He hasn't been able to keep anything down for the last 2 days. I don't know what to do. I just want to make him feel better.
Oh, I don't feel very well.
I will be right back.
Are you okay, Simon?
Stop it. I'm fine. Leave me alone.
I'm sorry, Jill. I didn't mean for you to hear that. Simon has had some bad experiences with doctors and hospitals, so being here makes him very upset.
That's okay, I understand. Here's a bag, Simon. Let's get you cleaned up, and I'll see what we can do for your nausea.
This is so embarrassing.
Okay, let's change your gown and clean you up.
I will step out.
Thank you. I am much more comfortable now. I am still feeling really nauseous though.
I will go get you some medicine to help with that. I'll be right back. Simon, this is Gravol. It should help make you feel better.
Thank you.
How are you feeling?
Much better now. My belly doesn't hurt and I don't feel sick.
Thank you, Nurse Jill. I felt so helpless. I am happy that he's feeling much more comfortable.
Perfect. Glad to hear I could help.
Can I have a glass of water? I need to drink more if I'm ever gonna get out of here.
Certainly. There we go, Simon. Try and keep drinking water. It's important to stay hydrated. And you'll need to drink lots since you lost a lot of fluid being sick. Thank you for explaining your comfort theory to me. I think I was really able to do a lot of comforting to my patient and his mother.
You're welcome. So you were able to provide him with some relief?
Yes, he was vomiting, so I cleaned him up and gave him some Gravol. It seemed to help. While everything was going on, his mother and him were really anxious. Once he wasn't so sick, they calmed down quite a bit.
That is good. Your comforting measures provided them with ease.
His mother told me that he has had some bad experiences, so he was very upset.
Those emotions and past experiences are called intervening variables. It's good that you were able to consider them when you provided the care.
Right. And since he's feeling better, he's making an effort to rehydrate.
That's a great health-seeking behavior. I am glad he is more comfortable and able to focus on bettering his health.
I know the doctor discharged you. I just wanted to say goodbye before you go.
Thank you for everything, Nurse Jill.
Yes, thank you. I think having a great nurse has really showed Simon that hospitals aren't so bad.
That's great, Simon. I am happy to hear that. I am glad that you are feeling better.
Well, that's it for today. I'm so glad our visitors were able to share such valuable lessons with our nursing staff. Their theories really improved the nursing care provided to our patients today.